Today our topic is beating breast cancer together, you and I, because on our own we can't do this. And how do we go about beating breast cancer? Well, when you think about it, when it comes to sports or anything else at all that you want to set your mind to accomplish, you first need to be aware of what it is or what the opponents have so that you can plan and work around it. So we're going to cover the basic facts about breast cancer. We're going to talk about the risk factors and prevention, which largely I think Dr. Melvin Luke also covered. And we're going to talk about some signs and symptoms which you can look out for and some of the other things that you wouldn't be able to feel, and hence the importance of screening with mammogram. We're going to talk about why benefits of early detection is important and the current screening recommendations here in Singapore. We're going to talk also about if you have an abnormality, what are the options of biopsy, and really it's not scary. And then what can we do to treat them? And in this talk, I'm going to just mainly talk about your options for surgery. Breast cancer, I think after hearing Dr. Luke's talk about cancer in general, you know it is a broad word that covers different types of cancers that arises in various organs of the body. Now for the breast, obviously it occurs within the breast. And there are several types because as you can see in the diagram here, our breast is made up of not just the fatty tissues and the fibrous tissue that holds the breast together. It is also composed of the glands, the glandular tissues, which is referred to by the ability to have milk production in the lobules, which is then secreted through the milk duct out to your nipple. Together, collectively, that's called glandular tissues, and breast cancer arises most commonly within this, about 80% of the time. So cancers don't just occur in these glands because the breast is composed of other things. And so there are many other types of cancers as well. And so one word, breast cancer, does not encompass one type alone. Now, regardless of the type, if you leave it untreated, it will progress. And these are just to show you that from the different areas that the cancer arises from, there comes the name as well. So if it occurs from the lobules of the breast, it's called lobular breast cancer. If it occurs within the ducts, it's called ductal carcinoma. If it is a mixture of both, and that's frequently what happens in advanced cancers, you have a mixed tumor. Sometimes it can go on and affect the skin of the breast, called an inflammatory breast cancer. Some of the facts that we need to know is that not only are breast cancer has so many different types that makes it very complex, the exact cause of it is also unknown. But as Dr. Melvin has already covered with you, for a person to develop cancer, really it's a multifactorial. Many things are in place together to cause a hit. So for breast, there are three major contributors, and they are the hormonal influences, especially the female hormones. They're the genetics influences, as well as the environmental factors. The third fact, breast cancer is very common. And in the United States, 1 in 8 women will develop breast cancer in their lifetime. And in Singapore, the statistics now is 1 in 15. And even from this website from Susan Komen, it has been found that every 19 seconds, somewhere in the world, a case of breast cancer is being diagnosed. And that is how common it is. Indeed, it is the most common cancer affecting women in Singapore. Fact number 4. Not only is the most common, it is also the #1 cause of female cancer-related death in Singapore. The good news is that there is treatment available for this that is accessible and effective. And although people used to hear very scary stories about ladies with breast cancer and having undergone chemotherapy and got really sick and even died from it, nowadays the tests that we do are much more accurate, it is less invasive, and even in terms of drugs, including chemotherapy, there are lesser side effects. And overall, the treatment becomes much more tolerable for the patient. So really, there is no need to fear. Fact number 6 about breast cancer. With colorectal cancer, you can certainly prevent it because if you do a screening colonoscopy, you can find a polyp and you can remove it before it becomes cancerous. Unfortunately for breast, there isn't really a particular way you can prevent it other than having an early detection, which will then become your best defense. You can see here that there are 4 stages of cancer, and this relates to most cancer. And stage 0 means that the cancer within the breast is still confined within the cells of the ducts and it has not yet gained the ability to invade other tissues or organs. And you can see this is a 100% survival rate if you have a stage 0 breast cancer, and we're talking about 100% in 10 years. The rest of them, as the stages progresses to stage 1 through stage 4, you can see that the survival rate has dropped. And this is a traditional figures 10 years ago. You can see now that with the improvement of all the oncology drugs and all the new targeted therapies, as we understand breast cancer biology more, the survival has increased up to 36%. What are the risk factors? There's several risk factors, some that you can control, some that you can't. But one thing is for sure, just because you have risk factors when it comes to breast cancer, it does not mean you're going to get it. And similarly, if you have no risk factors, because later on we're going to go through them and you're going to tick off the list and say, I don't have that, I don't have that, I don't have that, it doesn't prevent you from not getting breast cancer in your lifetime. So some of the factors that you cannot change, being female, right? Because I told you that one of the 3 major contributors to the development of cancer of the breast is your female estrogen hormones. So being female automatically puts you at a greater risk of developing breast cancer than the male counterparts. Age, as Dr. Melvin Luke has mentioned to you, cancer increases with age. Race, now with breast cancer, it's not an Asian thing. In fact, white women are much more prone to getting it, so the incidence of cancer is really high in the Western population. Asians, however, we have a lower risk, but when we get breast cancer in Asia, we tend to get it at a slightly earlier age, according to the statistics. Now, of course, if you have inherited genetic mutation, you are at risk of developing breast cancer, like Angelina Jolie. Most people think that breast cancer is a result of genetics, but actually only 5 to 10% of cases are due to genetic mutation. Some of the other things that you cannot control, family history. I think Dr. Luke also mentioned about familial breast cancers and familial colorectal cancers. Also for the breast, although the most common type of breast cancers occur sporadically in 70% of the time, 20% of them are familial, which means they do not have the inherited gene, but there is a family history. Now, if you yourself have had any lesions within the breast, either lumps or masses that have been biopsied, and you were found to have breast cancer and were treated, you are at risk of developing another breast cancer. If you had dense breast tissue, that's another risk factor. What do we mean by dense breast tissue? Many of you may have gone for a mammogram, and you will see your report with a one-liner that says, the sensitivity of mammogram is decreased with dense breast, and your breast is very dense. It just means that you have a higher level of fibrous and glandular tissue than your fatty counterparts. Yeah, because we saw in the earlier slide that the breast is composed of all these things. So if you have a very fatty breast, when you do a mammogram and the breast is squeezed, you can splay out the tissues nicely. The radiation passes through and you're able to see things quite clearly. But if you have a very dense breast, everything looks white, similar to the microcalcifications that we're trying to identify, which also will occur as white specks. And hence, you may miss some of the lesions in extremely dense breasts. If you've had determined diseases, by this I mean that if you've had previous lesions in the breast and you've had a biopsy that showed any of these conditions, as you can see the word atypical, it already suggests that the cells has had some form of mutation but have not yet become cancerous. So if those lumps or those abnormalities in your breast were proven to be any of these, you know that you're at risk, at increased risk of developing breast cancer because your cells are already changing. Now, previous radiation exposure to the chest is another thing that you cannot change, and by this I mean patients who have had lymphoma, which is a cancer of the lymph nodes that occurs in the younger population, and especially in the area of the chest wall. If they've had it, the only way to treat it, aside from chemotherapy, is actually radiation. And this radiation that we use to treat for lymphoma is a high-dose radiation, unlike the radiation dose we use in mammograms. And when they receive this, because I mentioned to you, lymphomas that occur in this population tends to affect the younger population. Their breast tissues have not really matured, and so as the cells continue to change, the radiation can really target it and cause a mutation. One of the other risk factor contributors to development of breast cancer that we talked about are hormonal